Yesterday a call came through to me at about 2:30, 3 o'clock in the afternoon, and I was hosting a meeting with our Lancet collaboration partners from across the world, an important meeting. I stepped out of the meeting to speak to Paula Gello from Ken Wyatt's office. And it was almost a case that a miracle had occurred, because if any of you understand, and particularly our overseas visitors, the current state of play with the Australian Parliament is such that it is so tightly balanced that to take leave from Parliament is almost an impossible achievement. So today we have the Minister for Health and Aged Care, Ken Wyatt, with us today. It's fantastic to have you here, Ken. So Ken was elected in 2010 as a federal member for Hasluck, an electorate east of Perth. As a Yamatji Noongar man, he made history becoming the first Indigenous member of the House of Representatives. So this is our very first in over 100 years. In September 2013, Ken became the first member for Hasluck re-elected for a second term. And since that election to Parliament in 2010, Ken has worked tirelessly to be a strong advocate for the electorate and to help build a stronger local community. In 2015, again, Ken made history as the first Indigenous member of the federal executive after being sworn in as the Assistant Minister for Health. Ken is responsible for aged care service delivery and implementation, Indigenous health, as well as dementia. Before entering politics, Ken worked in community roles in the fields of health and education, including the Director of Health for the Swan Education District and Director of Health. Many of us would know Ken as a colleague, a close colleague of ours, as a Director of Health, both in Western Australia and New South Wales. Not only has Ken had an extensive career in health and education, he has also made an enormous contribution to the wider community in training and mentoring young people. This was recognised in 1996 when Ken was awarded the Order of Australia in the Queen's Birthday Honours List. And in 2000, Ken was awarded the Centenary of Federation Medal for his efforts and contribution to improving the quality of life for Aboriginal and Torres Strait Islander people and mainstream Australian society in education and health. Ken brings his knowledge in the areas of health and education to the role, his current role as Assistant Minister for Health and Aged Care, as well as his lifetime experience. And Ken, we won't get you to disclose any secrets today that you may have with Lowitja, but his lifetime experience in a whole range of community areas. Pat and I met with Ken a couple of weeks ago, and we thought at best, because Ken did request a photograph of Lowitja to hang on his wall at his parliamentary office. So I sent through a photograph, and I thought that at the time that would be the best that we could provide. So it's a great honour to welcome you here, Ken, and please join me in welcoming Ken.
Kaya. Auntie, Diane, I want to thank you and Garen for welcome to country. As a Noongar man, leaving footprints on your country means something. It means that you have welcomed me into your community. Lowitja, it's always great to see you. I won't share the secrets that we often talked about. You probably, through that strictness, has taught me the discipline that I require to be a member of the Australian Parliament. And I appreciate the time that you gave me over the years, because you were significant in all of that. But I want to thank all of you for the opportunity to talk with you this morning And I want to respectfully acknowledge that this land that we met on today is the traditional lands of the Kulin Nation, and that we respect their spiritual relationship with their country, and that their cultural and heritage beliefs are still important to the living people today. I welcome Aboriginal and Torres Strait Islander peoples visiting from other parts of Australia, and I am very honoured to address the Lowitja Institute International Indigenous Health and Wellbeing Conference here in Melbourne. I'd like to acknowledge Dr. Lowitja O'Donoghue and thank her for her lifetime of advocacy for Aboriginal and Torres Strait Islander people. Dr. O'Donoghue's numerous achievements are well known to many of you here today, including her role as the founding chairperson of the Aboriginal and Torres Strait Islander Commission and as the inaugural chair of the Cooperative Research Centre for Aboriginal and Tropical Health, later incorporated into the Lowitja Institute. Dr. O'Donoghue was the first Aboriginal woman to be awarded the Order of Australia and was named Australian of the Year in 1984. Dr. O'Donoghue knows more than most, the importance of identity, knowledge, and strength to improving health and well-being in our communities. We must recognise and celebrate the strength that leaders like Lowitja provide, and use this as an inspiration to drive our collective efforts going forward. As a sponsor of this conference, the Department of Health values the opportunity to celebrate our shared achievements and to discuss the ways that we can continue to work together on closing the gap. Representatives from the department are in attendance, and I invite you to familiarise yourselves with some of the materials available on current programs, where we're seeing significant results, including tackling Indigenous smoking and the New Directions initiatives. I want to say that I'm proud of the government's commitment to the implementation plan for the National and Aboriginal and Torres Strait Islander Health, which was released just over a year ago. What a huge step forward to have racism recognised as a critical issue to be addressed in the implementation plan. I also want to acknowledge many in this room that I have worked with and walked with. And I'm honoured to see that your commitment and that determination to make an incredible difference still prevails within you. And I want to acknowledge the contribution that you have collectively made in the journey to where we are at the moment, but equally to the future that we have still yet to address. Many of you have taught me much, and equally I hope that I have shared things with you that give us the understanding to build the strength of our community, but to build the capacity for the future of our children to live longer lives, to live them well, and to contribute to an Australian society that welcomes and respects differences in culture in a way that we've not seen before. And to all of you who've come across the waters, I welcome you to our country. And the themes that are evolving and that will continue to evolve over the days that you are here will give you the opportunity to become connected, to develop the networks that will contribute to your own work, but equally for you to build on what transpires out of the papers that are presented, the ideas that are being forged, but the passion within you to achieve those outcomes. Our people need to feel culturally safe in the mainstream health system, and the Cultural Respect Framework, launched at the South Australian Health Forum only weeks ago, is a key part of our strategy. This is where I believe we can make a real on-the-ground difference to the health and well-being of our people. Further, I am delighted the implementation plan has sown the seeds to tackle the social and cultural determinants of health. The social and cultural determinants of health underpin everything that we do, contributing to at least 31% of the gap in life expectancy between Indigenous and non-Indigenous Australians. And I was privileged to be one of the Indigenous leaders that worked on the Aboriginal and Torres Strait Islander Health Performance Framework, in which there were 3 tiers, but the second tier was dedicated to addressing the social determinants. These issues can only be addressed through the whole of government action. The next iteration of the implementation plan, due in 2018, will be stronger because of the ongoing and new collaborations and partnerships. There is a significant amount of work already contributing to closing the gap in states and territories. As managers of mainstream services in the acute and community sectors, state and territory government engagement is also very crucial. At the end of August, the Australian Health Ministers Advisory Council agreed to a nationally focused 2018 iteration of the implementation plan. To action this commitment, ARMAC, or the Australian Health Ministers Advisory Council, has tasked its National Aboriginal and Torres Strait Islander Health Standing Committee to oversee this important work. But we recognise that governments cannot progress this agenda and action alone. This can only be done in collaboration with Aboriginal and Torres Strait Islander people. To assist this, the Department of Health has established the Implementation Plan Advisory Group. Representatives from the Department of Health, Prime Minister and Cabinet, and the Australian Institute of Health and Welfare will be joined by Richard Weston from the National Health Leadership Forum and the Healing Foundation, and he will be co-chair. Pat Turner from the National Aboriginal Community Controlled Health Organisation. Donna Archie, Julie Tongs and Mark Wenatong as experts on Indigenous early childhood, comprehensive primary health care and acute care, amongst numerous other things. And to ensure we get the right advice, jurisdictional members of the National Aboriginal and Torres Strait Islander Health Standing Committee have also agreed to join this advisory group. There is a lot of work to be done with the implementation plan, but I'm looking forward to engaging in partnership to reflect our joint efforts and ambitions to close the gap. As we all know, health departments and health providers are only part of the solution. We need an integrated approach to Aboriginal and Torres Strait Islander health. To have strong, healthy children, we need to have an effective early childhood education. Employment needs to be resolved, housing, economic development, and environmental outcomes. As noted in the implementation plan, good health enables participation in the labour force, which models good behaviour for children to go to school and provides an income that can support healthy choices, good nutrition and exercise for individuals and their families. Conversely, chronic health problems can limit participation in the workforce and educational and training opportunities, which can have adverse impacts on families. The implementation plan has 7 domains that cut across the health system and the life course and include a focus on both community-controlled and mainstream and government services. 2 out of 7 domains focus on early childhood years and maternal health and parenting, where the evidence showed that we can have the biggest positive impact. Social and environmental influences in early childhood shape health and wellbeing outcomes across the life course. The period from conception to age 3 is particularly critical. Babies are born healthy and arrive at school ready to learn and have improved school attendance, attainment, and later employment and life outcomes. The period from conception to 3 years of age is where we can set people up for life. Our Better Start to Life programs, New Directions, and the Australian Nurse Family Partnership Program focus on improving outcomes for Aboriginal and Torres Strait Islander children. And the broader health reform agenda that government is driving also has many positive outcomes for Aboriginal and Torres Strait Islander health across the life course. In my area of responsibility, aged care, where ambitious reforms are opening up how aged care work is delivered and funded, so that the innovative tailored services for Aboriginal and Torres Strait Islander communities run by communities themselves in ways that best work for communities and older people. This is really important to me in the scope of work that I have. The revised implementation plan will set the agenda for going forward by identifying new priorities and emerging opportunities. As I look at the agenda for this conference, firstly, I congratulate the Lowitja Institute for bringing together such a remarkable group of speakers. And secondly, I am excited that we are all here to hear the latest research and new ideas out there to tackle the health issues head on and close the gap. Finally, and to reiterate comments from the Prime Minister, it is critical that the government continues its policy of doing things with and not to Aboriginal and Torres Strait Islander people. The Australian government is confident that by working with our partners in developing and implementing these actions, we will see significant steps taken to close the gap in health outcomes. Closing the gap is everybody's business, but how we go about it, that's our business. I know how important it is to government that the partnership approach characterised in the development of the implementation plan continues as we work towards achieving its 106 deliverables. Working collegiately and in partnership has been critical to the preparation of the implementation plan. I look forward to working with you on this next stage of the journey going forward, and we know that things aren't all perfect. But we know we have voices and a place at the top table, and if we can embed cultural competency into the way all services are run, so that cultural competency and respect are recognised as fundamental to health outcomes for our mob, that is going to be a significant shift, but a critical one, and it has to happen. Our strength is our future, and we have to grasp it as individuals, as organisations, but more importantly, as professionals and as Aboriginal and Torres Strait Islander communities, because it is through us collectively that we will make the changes that are needed. Take up what is within us culturally, what is within us spiritually. Take our combined strength of commitment to improving the lives of all First Nations people, to change the destiny pathways of our people through our combined efforts to improve and then maintain the health and well-being of our people. It is through your collective work that you do that governments have the opportunity of shaping what is delivered on the ground. Already this morning, in conversations with some of you on the way through, you've expressed that desire. And having moved from being one as a public servant, working as a colleague and in a collegiate role with you, I have been given the incredible opportunity of heading up Aboriginal health and taking responsibility for the reforms and changes that we need to make. But that cannot happen successfully unless we work together, that we walk together, that we note our differences at times, that we have the vigorous and open discussions about what it is that we want to achieve and how we achieve it. When we do that, then we will see the changes that many of us have worked for, fought for, and walked beside others for. I wish you all the best in your deliberations. I am envious of the fact that you will have some incredible speakers, some incredible sessions, which I would love to have been part of. But I know that you will take this and take it forward, not only within Australia, but in those countries that have joined us, and for those people who have joined us from other countries, and collectively maintain the network that gives us the strength as Indigenous Australians, and let's walk together to make that difference. Thank you.